why your blood group. And do you remember the blood groups? You could be A, you could be B, you could be O. Then in those, we have the rhesus. You could be A positive, A negative, B positive, O negative, O positive. So we want to know what blood group are you and what rhesus. The rhesus is now the positive and the negative. Where are you? Why? To help us manage your pregnancy and any eventualities if you may need to be transfused. And a little bit more, it is good to know your spouse or your partner or the father of this child. It is equally good to know his blood group and rhesus. So if you know, and if your spouse or the father of your child, this current child, is negative, please remember to discuss it with your healthcare provider. And then, in the same blood, we may do a random blood sugar. Or you might be pricked a little here, and a stripe is just taken to check for the random blood sugar. We want to rule out diabetes, because there is a measure. If you've just taken a meal, and somebody who took a meal the last 2 hours, and somebody who has not taken any meal the last 6 hours, we call it fasting, all those blood glucose levels are different. So once we know the glucose level and the duration that you have taken, if you've just taken a banana like 30 minutes ago, and the glucose level is high, that one we expect. And maybe to rule out anything, we may ask you to come back to the hospital tomorrow when you've not taken anything and we do a fasting. We want to know, are you diabetic? Or are you pre-diabetic? And manage you accordingly so that we do not risk anything, especially to you and to your baby. That is why you'll see us doing a random blood sugar, then a fasting if need be. Now that one is at your care provider's judgment if you need a fasting. Kindly note, very good hospitals, I call them very good because I give them points. They might do random blood sugar or fasting blood sugar every time you visit.